Hello, my name is Dr. James Davis, and I want to welcome you to the Tobacco Dependence Pharmacotherapy course. This is a one-day course designed for medical professionals. I'm an associate professor in the Department of Medicine at Duke University. I'm an internal medicine physician and continue to see patients. I'm the medical director of the Duke Center for Smoking Cessation. It's a research center, director of the Duke Smoking Cessation program, which is a clinical program. And then I'm also co-director of the Duke-UNC Tobacco Treatment Specialist program, which is an educational program. We are teaching this course because smoking remains the #1 preventable cause of morbidity and mortality in the United States. And the course is really the first of its kind. It's a course designed for medical providers, physicians, pharmacists, NPs, PAs, who on average receive an hour or less in training on tobacco dependence treatment. In the last 15 to 20 years, there's just been an enormous amount of research that's been done on treatment of tobacco dependence. And we now have a considerable body of evidence to guide practice for medical providers. And this course is really an attempt to bring together that body of research and put it together in a way that is meaningful for medical providers. We assume, if you're taking this course, that you are a medical provider, that you see patients, you write prescriptions, manage side effects, make dosage adjustments, that you sometimes deal with insurance companies, write prior authorizations, things like that. We also assume that with regard to behavioral treatment, you have some limitations with your time, that you may not have an hour at a time to work with patients, and may be more like 20 to 30 minutes. This course provides 7.5 CME credits. It's joint accreditation, so it covers multiple medical provider areas. Essentially everything that we could accredit. At the end of the course, I expect participants to be able to use tobacco treatment medications with a lot of flexibility. In fact, you should be able to tailor medication treatment to hospitalized patients, renal failure patients, patients with very high dependence, low dependence, like cue-based smokers, people with weight issues, really be able to manage a large range of individuals with tobacco dependence and provide more effective tobacco treatment therapy, but also with fewer side effects. And I actually have every confidence that would be an outcome of this course. I would also expect that you would gain an understanding of how to use evidence-based behavioral treatment within a medical setting, within the confines of that short medical visit that we often have. This course has 3 video sections followed by 3 interactive sections. The video sections include an introduction where we get into the various kinds of tobacco and tobacco-related medical problems that people run into. And then we also will talk a little bit about e-cigarettes and about the newer products like Zyn and the heat not burn products. Then we'll get into neurobiology, which is really the underpinnings for tobacco dependence pharmacotherapy. It is why medications work the way they do. And that is really foundational for understanding the pharmacotherapy agents and being able to use them with some facility. Next in the video series, these 3 video series, we'll get into the pharmacotherapy agents individually. We'll talk about why they work the way they do, how they, what the dosing looks like, how dosing can be changed, what side effects look like, how side effects can be ameliorated. And then we'll talk about costs and insurances, coverage, and kind of how to work with those challenges. In the interactive sessions, things will get interesting. We'll be getting into individual cases of patients with one problem or another and how to understand the literature to apply it to those unique cases. and that will really get into the wider variety of what we commonly see in everyday practice, and help you understand how to apply evidence to those situations. We will then walk through multiple patient case scenarios to kind of show examples of how the evidence-based practices are used in individual cases. Finally, we're going to look at behavioral treatment and how pharmacotherapy and evidence-based behavioral treatment can be integrated within a medical visit. There is a 4-day course, the Duke-UNC Tobacco Treatment Specialist course, that I teach with my colleagues, and you can find out more about that course, the Duke-UNC TTS website. That course provides a much broader basis of understanding tobacco treatment, goes into behavioral treatments in greater depth, but does not go into pharmacotherapy in greater depth. That's going to happen in this course. I'm very excited to meet you in person. I'm very excited for you to be a part of this course, and I look forward to seeing you soon.